Let's talk about endodontics and internal bleaching of a dead tooth. You can see how this tooth is darker than this one. So in this case, we performed endodontics on this tooth, internally bleached it, and then externally bleached the rest of the teeth. And the objective is not to see how white you can get this one, but to match it to the adjacent teeth. So this patient had an old crown on this tooth, but she wanted this tooth to match the central. Click on the blue link in the description below and subscribe to dentistrymasterclasses.com if you'd like to have an organized library of all the Dental Minute videos, plus many complete comprehensive cases not seen in Dental Minute videos. Subscribe now. This before and after. The endo with some paste out the tip of the tooth just a little bit, which I don't mind at all. So watch the link on how to give a painless injection. I was thinking the other day, I can't tell you how many patients I see and the first thing they say is, I am terrified of dentistry because I had a terrible experience with a dentist working on my tooth and he couldn't get it numb and he had to just keep going, like a root canal or a crown or something like that. You have to use intraligamental. And the way you do it, you place the bevel in the tip of the 30 gauge needle in the sulcus with the bevel turned toward the tooth. And this is Sit-Nest 4% plain. It's pH neutral. So 30 gauge needle, Sit-Nest 4% plain with no vasoconstrictor. And you first blow topical anesthesia on that area, and then you just put pressure for about 20 seconds. And sometimes I'll numb both sides, and those teeth will be dead numb. Learn how to use this rubber dam technique. Okay, so I'm accessing the pulp cavity, irrigating with local anesthesia. So we've got a necrotic pulp. Here's the pulp cavity, and I'm using my computer app to measure the length of the tooth, which from incisal edge to apex is about 21.5 millimeters. So these are the things I use for endodontics. Rotary files, endosequence, that's this group right here, and I use the mediums more often than anything else. Now I've switched to this file, the EJ02. A single file does all the filing, and it's very efficient. I'll often use a 35 in conjunction with this file just to open up the coronal part of the tooth and not go forcefully into the canal, but just open it up and clean it out so there's no binding of this file on the coronal part of the canal. This scalp file is worth its weight in gold if the patient has sclerotic canals or tiny canals. You open into the pulp chamber, and you know how sometimes you just can't find a canal. Well, this scalp file is so fantastic because you put it on the handpiece and just, I put lubricant in the pulp chamber and then just poke on the floor, and it'll drop into that canal that you can't find with a hand file. And the hand files I use are size 10, 25 millimeter, K-type, and Hedstrom. So this is my armamentarium, the EJ02, the hand files, Hedstrom and K-type, size 10. The rotary files, they've got small, medium, and large. In most of the canals, I use medium, and I'm getting away from these and going mainly to this one, and also using the 35 to just open up the coronal part. And then the scalp files I can't live without. Okay, so the first thing you do once you've entered the canal, you've accessed the canal, is you want to file it with a hand file and clean the nerve out. And I generally use a Hedstrom. And so you can see it was 21.5. I've measured this to 22. And I put it in the canal and I'm hand filing. Now, why do I use this? I've never separated an EJ02, that single file, single drill. But if you're using the 4 files, mechanical files, you will separate one of those at some point. So if you've cleaned out and irrigated that canal with the hand file first, and you separate one of the drill files, the rotary files, it's not that big a deal because the nerve is cleaned out of the tooth. And so it becomes like an old silver point. And sometimes, as you know, removing a separated file from a root canal is a complicated procedure. And you can actually damage the root trying to remove it. I'm not saying separate them. I'm not saying don't try to remove them. But it's complicated. And what I've learned is if you clean it out with the hand file first and irrigate it, and clean it out well with that Hedstrom and K-type hand file, so the nerve is basically removed, then if you should separate a rotary file, it's not that big a deal, and knock on wood, I've never had an issue with the tooth having a problem. And the reason I don't try to remove those is I don't want to perforate the root and make a situation that's not ideal worse than it was. I'm cleaning, and then I'm going to measure with my PAL Precision Apex Locator, and this is perfect. You want the measurement to be 0.5. Now I'm coming back with the file and irrigating. Now this is 3-to-1, 3 parts water, 1 part 6% sodium hypochlorite. 3 parts water, 1 part 6% sodium hypochlorite. Now many endodontists use straight sodium hypochlorite. I don't. I've used this dilute solution for 40 years when I was taught by a very good endodontist from East Texas giving the seminar at my teaching center in Dallas, and he said he uses 3-to-1 water to sodium hypochlorite because when he was back when he was using straight sodium hypochlorite, there have been situations that got down into the mandibular canal and damaged the inferior alveolar nerve. So I don't want you to have something happen that's devastating. And so this cleans it out very, very well. Don't squirt it in under pressure. Just fill up the chamber and it'll go down into the canal. The idea is to have lubrication, and it floats everything to the top. We're going to really float everything to the top with the local anesthesia in a 30-gauge syringe in a minute. So the main objective of the 3-to-1, 3 parts water, 1 part sodium hypochlorite is to lubricate the canal and kill all the bacteria that's in there. And so you just want to very gently squirt it in the pulp chamber. It'll get down into the canal, especially when you're using the hand file or the rotary drill. So now this is the EJ02. So we've measured it already with the hand file, and we know the measurement is correct. Now we're using the EJ02 to clean it out, and I've squirted the 3 parts water, 1 part sodium hypochlorite into the pulp chamber, so it's well lubricated. You don't ever want to file a dry canal. You always want the canal to be lubricated, and you don't have to squirt the 3-to-1 sodium hypochlorite into the canal forcefully. Just drip it into the pulp chamber, and the rotary drill will take it into the canal. Now I'll just go into the canal very lightly and then pull back, and I'll do that with the EJ02 about 10 times and then irrigate it again. Now this is the 30-gauge needle with local anesthesia. The local anesthesia is of no consequence. It could just easily be water. It just so happens that the 30-gauge needle is what we want because that fits into the canal, and the local anesthesia is just an irrigating solution. And you don't put it under pressure, but you do squirt it up into the canal, and it rinses all the sodium hypochlorite and any bits of debris out of the canal. And that EJ02 widens the canal to a size 30. So you can automatically go to a size 30 gutta percha cone after you've cleaned it out with the EJ02. This is a 30. And here's the cone in the tooth periapical radiograph. Then I'm going to dry it with paper points. Now these paper points were 35s, one size larger, because I don't want to really go past the tip of the tooth, and that might elicit bleeding. Now what if you do have some bleeding? Try to stop it with the paper points. Just put one in and leave it stuck in the canal for a while. But if you do have a little bit of bleeding, go ahead and fill the canal. It's going to be fine. And this just the BC paste from Brazilier, and you squirt it in Endosequence BC sealer, and you squirt that into the canal with a little bit of pressure. And then just put the cone straight in. Now this is the heating element, the EndoPro 270, and you sear off the part of the cone sticking out of the canal. And then I'm going to plug that part, plug it with that plugger. Now I'm marking the CEJ, the depth, the length, where the CEJ is. That was the mark I placed on here. And I put this to place and I marked it with the magic marker, and then I'm going to put it on the facial and see if that is the distance from the incisal edge to the CEJ, because you want to block off the part of the canal apical to the CEJ. You don't want the bleach, the 30% sodium hypochlorite, you don't want the bleach, the 30%, you don't want the bleach. You want to block off the canal with Ketaxim or glass ionomer cement, ideally, or some other type of cement, because you don't want the 30% hydrogen peroxide to get down in the root of the tooth to go past the enamel, because it can come out the side of the tooth on the root. So you don't want it to get down to the root. So I'm removing, just cleaning that out down to the CEJ is the objective, because we're about to internally bleach the tooth. Now this is Ketaxim glass ionomer, and I'm using a periodontal probe, just putting the tip of it in that very runny Ketaxim. You don't want it to be hard when you mix it. You want it to be very fluid, not viscous. And you put that at the bottom of the pulp, at the apical part of the pulp chamber, to block off the canal of the tooth, so the hydrogen peroxide does not go down the root and come out the sides of the root, and that could damage the alveolar bone. And then once you've placed this, you can see I've placed the Ketaxim. Go check a hygiene patient. Let it set up for about 5 minutes or so before you play. And then I'm cleaning this out with a slow speed round burr. Then the internal bleaching is done with 30% hydrogen peroxide and sodium perborate, which is the same material stylists used to dye women's hair. You mix that together. But the way you mix it, if you mix the hydrogen peroxide with the sodium perborate in a dappen dish, it's going to bubble up and froth. So you have to put them in separately. So I put the hydrogen peroxide on a small cotton ball and wiping it in the chamber of the tooth first. Before you do this, you want to take a round burr and freshen the dentin inside the pulp chamber so it's not sclerotic, because you want that sodium perborate and hydrogen peroxide to get in those tubules and bleach the darkness. So you take a round burr on a slow speed handpiece and just freshen the inner part of the pulp chamber so it's a very fresh surface and the dentinal tubules are open. Then I'm coming back with the 30% hydrogen peroxide on a cotton ball and just scrubbing the inside of that pulp chamber. Just scrubbing, 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 and leaving some of that liquid in there. Then this is an amalgam carrier, and I'm placing the sodium perborate in the pulp chamber that's been wetted with the 30% hydrogen peroxide with that amalgam carrier. Usually use the small end, place it, and then you're going to plug it with a plugger. Just be sure it stays wet with the hydrogen peroxide. If it ever is not wet, just put some more in there. Now this, you'll see these little balls. I've not used that type of hydrogen peroxide, of sodium perborate before. Normally it's like a powder. I think I like the powder better. This was just a different make. This worked just fine, but it's a little harder to compress. And so the objective is you want to fill it up with the wet sodium perborate crystals, and then you want to remove about a 1/2 millimeter so you've got room to place your IRM sealer or buildup. See, so that's what I'm doing right now, and you'd like the prep to be undercut just a little bit so it holds that IRM buildup. This is just a spoon. Just a wet cotton ball. So here's my endo, my cone, and then I've got some extra BC sealer out the tip of the tooth, which is fine. That just means you cleaned everything out real well. So after 2 days, you're going to remove the bleach. This is just a Brasileir, some type of burr, and then irrigate it out real well. And then you're going to, if the shade is right, you're going to go ahead and etch it and seal it with composite. If it's not dark enough yet, you're going to re-bleach it. You're going to put the bleach in for 2 more days. Normally, though, it's bleached after 2 days. So I'm rinsing that etch out. Primer adhesive. Blow that off, cure it. You can either use flowable or you can use highly filled. In this case, I'm using flowable in layers because it's a lot easier to place. Then I'm going to cure that for 40 seconds and then polish it with a fine football diamond. A lot of water. Tap, 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 tap. This is a Shofu rubber wheel just for the final polish. And I like to drip water when I'm doing that. There we have it before and after. So that's the Dental Minute. These techniques work, and they work every time.